Hi, my name is Ajit, and I am excited and happy to have this opportunity to share one of the components of my ongoing research with the South Asian community in British Columbia. I have a short PowerPoint presentation to share with you. In the first video, I actually introduced this research design, and we discussed about the phase one of our findings that showed that the South Asians have higher rates of oral cancers, and these cancers were seen at the sites which are associated with chewing betel quid and smokeless tobacco. In this phase, we'll be talking about the qualitative component of the research. Although we know that they have higher rates, we do not know South Asians are continuing chewing betel quid and smokeless tobacco after immigration in British Columbia. And what may be the reasons and social cultural beliefs associated with use of these products? Before we proceed further, let's look what's a betel quid. So a betel quid is actually a leaf, which is the betel leaf. There is a lime in it. There is a nut, which is the areca nut, and there's a leaf within a leaf, which is the tobacco leaf. It also has some cherries and mints, which is another form of quid in which people can add tobacco according to their preference. It is an integral part of the South Asian culture, and it is used for a variety of health beneficial effects. It is also considered as a symbol of royalty and starts at an early age and considered as a socially acceptable habit. It is popular among film stars and there are songs dedicated to use of these products. However, in 2004, IAC monograph showed that betel quid with or without smokeless tobacco is an independent risk factor for oral cancer. And when we started our fieldwork in Vancouver, we found that there are many places where the betel quid and smokeless tobacco were available. This led to our second study, which was an ethnographic study that was conducted to better understand the social cultural beliefs associated with betel quid and smokeless tobacco use. We used an interpretive ethnographic approach, which is an effective method to investigate such health issues. Our findings suggested that South Asians perceived betel quid as chewing gum in Western countries because both of them have mouth-freshening properties. And just in Western countries, there was introduction of nicotine gum for smoking cessation. In South Asians, the perception was the addition of smokeless tobacco leaf to a normal betel quid is actually a form of Indian version of nicotine gum. They considered that using a tobacco leaf is actually an organic form of tobacco and it was safe to consume. It doesn't produce any smoke and it is a smoke that have all the carcinogens. That's why it is even safer to actually consume it among family and friends. There is no smell from the mouth and you don't have to adjust your respiration and breathing. It can be consumed safely at public spaces. And if you want to consume betel quid in night, you can just put it in your mouth and sleep. Whereas if you have to smoke, you have to go outside the house. So it's not very convenient to smoke at night, but it is very easy to chew at night. And it is very cheap. We found out in our research that there was widespread awareness about ill effects of smoking among South Asians that actually prompted them to start chewing betel quid with smokeless tobacco leaves. There was lack of awareness of harmful effects of betel quid with smokeless tobacco leaves. And although this habit was very prevalent, it remained hidden from the mainstream society because of the very nature of this habit being practiced, and it is kept inside the mouth. And nobody is looking inside the mouth to see what you're chewing. Nicotine content of betel quid with smokeless tobacco leaf is higher. We found that the sales were not regulated. There were no restrictions for the sales to minors. There were no health warning on the wrappers. It was openly sold without any taxation. And not only it increases the oral cancer risk, it also increases the risk for other cancers like hypopharyngeal cancers and other chronic diseases like cardiovascular diseases. Our research have a lot of implications for policy and practice. More importantly, betel quid with smokeless tobacco leaf needs to be brought under tobacco control policies of British Columbia. We need to have a culturally appropriate health promotion and education interventions for South Asians and have access for oral cancer screening for them for an early detection to improve their survival rates. Also, this will save cost uh, of treatment to the province. Thank you very much. And in the next video, we'll be talking about the development of an educational interventions based upon the funding of our qualitative work.